I'm Taylor Nutterfield. It's nice to meet all of you who are following us on Facebook Live at the Boys and Girls Center. So thank you guys for having me today. I am a recreationist for Fresh Bloom. We're a local company here in Austin that serves different populations, anywhere from recreation and recovery to developmental disorders, which is why I'm here today to talk about fitness and wellness. I've played professional beach volleyball for a very long time, so fitness is very important to me, and being physical and having purposeful movement is something that I think typical, atypical, all people really strive to do. So it's going to be very exciting today for me to be able to introduce some things that I think are important movements for this population, as well as I think anybody can use daily. So today, let's kind of start off with what is fitness, what is wellness, what is purposeful movement. For our population here today, I do quite a few things with my clients with developmental disorders and autism, including aquatics, nature, using outdoors for recreation, as well as adaptive devices and fitness. Later on today, I'm going to talk about what I think about fitness versus sports for the autism population, and how I think that we are leaning towards a way to move towards fitness programming. And I'm going to end up talking about a special program that is coming out nationwide that I think is going to be very, very relevant within the coming years for our population. And I use it day to day. So it's for everybody. It's good. And then at the end of this, we'll do a little question and answer. So I'll start a little bit today. I've got some stuff that I might be coming in and out of, so don't think I'm leaving you guys. But we'll start with aquatics, because aquatics is where my home started with recreation therapy. I've always worked with guys with developmental disorders, and in high school, I always worked with guys with Down syndrome, either in the pool or with adaptive sports, which I know is different than this population. But I use aquatic therapy pretty much all the time. A great tool for this is more getting into the water feels like womb-like again. So with our guys that have perseverative behaviors, it becomes more like a hug or a jacket, something tight, something calming. And you immediately see it when you see guys get back into the pool and see that they're in a calm place and ready to move, maybe not so fast or faster than normal, because everybody's all over the place. So with aquatics, I practice several different things. We do anything from cardio to gait training, because in the DSM-5, autism's been redefined as always. And in the DSM-5, there's no talk about the physical delays, which as a therapist who regularly is in this population, I think we need to address more, because if families who know this, it's gait training, poor trunk stability, low hip range of hip flexors, which results in poor posture. So those are all things that we're trying to address in all the things I'll talk about today. So in aquatics, that's normally where we go. This thing I'm holding right now is a neck doodle, which can be used for all sorts of things. I don't know how much the camera can see, but it can be used as a flotation device. It can be used for learning swimming skills. And my favorite is a thing called Badragas, which is an Eastern type of water tai chi that the therapist uses as kind of a way for a client to relax. And we address maladaptive behavior, social cognitive, emotional regulation, and then we can get the client in a good place where we then do gait training, and we do some sort of motor functioning or use tools like this, or the noodles that I'm not going to bring out of the bag because I think that'll be a little intense, that also help with balance, stability, trunk regulation. And it's just a great place. I don't know. I think that with a lot of these guys, changing the environment and still making it structured is a great way to go. So the next topic I'm going to bring up is being out in nature, which I'll bring up again later when we come into fitness, because again, the environment is something that I think is extremely important for guys to be used to getting in different settings, so that those behaviors that we see become a little bit less frequent, or we can regulate them in all circumstances. So it can transcend to school, it can transcend to home, all those places. And research has shown that there's plenty of great things that come with being in nature for all people across the board. Emotional regulation, cognitive, being in a new place, seeing new things, being in the open air. So just very important. I like the environment. And then last is I'm going to kind of start introducing our way into fitness versus sports. So previously, me and my boss Sarah at Fresh Bloom, we've done work with a research group study with a group called Primal 7, and they're very prone to learning about teaching guys 7 basic movement patterns, which will transcend into Autism Fitness, which I'll talk about later. But it's working on 7 different types of movement. You've got your push, you've got your pull, you've got your squat, you've got your lunge, you've got your twist, you've got your gait, and wait, 1, 2, 3, 5, 6, 7, 8, push, pull, lunge, squat, twist, gait. Oh no, what am I missing? Missing one. But and then but all that stuff kind of works into the things that we're trying to elongate: the hip flexors, the core stability, the tall posture, the being able to move and be really increase the physical fitness of a client, so then they can start doing ADLs more independently. They can then start doing they can start reducing their maladaptive behaviors. They can have higher health. Regularly I'm asked, will you take my child to go to the gym? And that's where we'll start. And so as an athlete, as someone who really enjoys being healthy and working on preventative measures to make sure injury doesn't happen with kids, adults, anybody in the gym, our clients are very special in the sense that we know as therapists, attendants, that these guys are special. So maybe there's times when 45 minutes on the treadmill may seem like a good idea, but it's not. But that's also for typically developing people too. So learning how the body moves as an attendant, as a therapist, as a parent is great. And then being able to instill that into your child, into your patient, into your client, like that's all good things to know, so that when you guys go to the gym, there's movements that you're focusing on. With fitness for me, this little dichotomy between fitness and sports with our guys is very big. I love sports. I play sports. My mom loves sports. Well, my mom doesn't really love sports. She likes me playing sports. But I understand parents and caregivers wanting to include and see the social aspect that we all see as typically, which I don't think anybody's really typically developing, but as most people think that is normal. So when you're doing sports, it's very important to know abstract theory, to already have general fitness principles, and those first two things are already things that our clients kind of struggle with. We need to start working on the physical fitness, and then the abstract theory is like, man, worked with clients, I was like, I don't really think we care about winning or keeping points right now. So we end up trying to force that abstract theory instead of the fitness principles and the social aspect, and that kind of gets lost. And to keep our guys focused, I think that fitness really is the way that we need to start branching into, because sports is seasonal, fitness has no season. And fitness is something that now in our population we're getting into. It's not a niche, but we have SoulCycle, we have Orange Theory. There are things that is communal and things that are social aspect that we can make fitness into that will then become a group setting. And with more people getting trained, with more people understanding the way the body moves, the body works, the healthier we can make our clients, our children, our friends, the better for the whole population. I think it's great. So that's my little spiel on sports versus the fitness aspect. I don't think sports are bad. I need everybody here. If you think that you're higher level or lower level, whatever level you're at, you want to try sports, I definitely think you should try them. However, I do think fitness in itself is going to end up becoming something that's better for our guys to become healthier. We just have to figure out a good way to keep it safe and something that they understand. So that'll bring me to working towards Autism Fitness. So Autism Fitness is something that was created by Eric Chesson. He's worked now 2 decades with guys with autism, adults and children, and has come up with this amazing system that me and my boss just went through. I'm not here to sell you on it. I'm not here to push it, but from my personal perspective, as a background as an athlete and a player and a person who loves fitness, and from a practitioner, so far they combine the best of both worlds with BCBA principles, combining cognitive, adapting fitness to make it understandable. And now I not only do it with the kids I coach volleyball with, which are ADD all over the place kind of kids, to my any type of guys that I have with developmental disorders, and I work with some addiction guys, and it's all that just knowledge is pretty helpful all around. So what is Autism Fitness? Autism Fitness is a system that Eric Chesson has worked out where he figured out a way for the program to kind of be set in a way that is understandable for our guys with autism. So to begin, he sort of decided that, man, what is happening? Why are we not getting through to this population? Like, why are the gross motor deficits not being addressed with these guys? Why is it that we can't get these guys to stay focused for a long time? Because he was a professional powerlifter. So what ended up happening is he came up with this concept with these tools that I'm going to be showing some equipment later today, but know that this equipment doesn't need to be bought. Most gyms have this. You can adapt it again, is what I'll talk about. I love the fact that there's adapting different systems for us to be able to work on the main different motions for guys, the hinging, the moving, the twisting, things that will make sure that those I don't know if you've seen your guys just immediately plop down, like we're guilty of doing it, going home and you want to sit on the couch real fast. But that's not building any type of trunk stability. That's not slowing down our mind, having a flexible brain. So what I will end up showing you guys is different tactics and tools that I think is helping in the fitness realm that I think will be very good for us later on. One big thing that he pushes is that make the environment an inevitable success for your client, which will be the progression versus regression on a bunch of this stuff, and being able to have a way that there are tools available and it's an easy fix. So you as a mom taking your child to the gym, or you as an attendant taking your client to the gym, it's something that's easy and working and able to do. So I'm going to get that stuff in a second. Sorry, I'm debating on what's the best way to show you guys how to make this work a little bit better, because I was hoping some of you would be here on Facebook Live and then we could demo. So I might grab one of you guys to come help me out. But what'll happen is you start by labeling a concept for these guys. And another thing as a practitioner that I sometimes have a tendency to do is go way too fast. But we need to know with these guys with autism is that by the time that we are bored as practitioners, they are just finally understanding the concept. And so repetition, consistency, and simplicity in fitness is going to be our way to propel guys to have stronger trunks, better hip flexors, better gaits, better confidence. Standing up straight is just a great confidence boost. So being able for those guys to be able to accentuate that and being their best selves and enjoying what they're doing in fitness, something that I really think that is valuable. So making it simple. So things that I think I learned the best from, again, this is stuff that I got through Autism Fitness, but I know that there are cheaper options, are colored cones. We have many colored cones, and you know who likes cones? Our guys. You know who likes organizing these in certain ways? Our guys. So that's why we have different tactics, and if you lay things out, what do you think? Okay, oh, gotcha, here we go. So if I say, please touch the purple cone, and then touch the yellow cone, that's easy one-step commands. So by being able to set stuff up like this around your system is a great way, because compliance is pretty easy for most of our guys. If not, then there's maladaptive behaviors that need to be addressed, but that's something that's pretty general. So what we'll do is by being able to start as we start with a hoop, or you start with a circle or a band, something low to the ground, and you just place it on the ground and say, please put your feet inside the hoop. And then our bodies are in control. We're at a calm state of mind, and then we can start an exercise. There's plenty of exercises that Eric Chesson has online. There's plenty of exercises Primal 7 has online. You can do your own stuff at home, because what I like about the concept of fitness is it can be play. Play is super important, and it gives the autonomy and locus of control back to the client. Every day we hear our clients say, all right, 8 a.m. wake up, 8:15 breakfast, and we have our regimented. I learned that in undergrad, grad school, all throughout my whole entire curriculum is you develop stuff for guys with autism that where they need that setup structure. But I hear that, whenever I hear that in grad school, I was thinking, man, that's a lot of no's during a day. Like, no, you can't have breakfast at 8:17. No, no, we shouldn't probably eat like the whole bag of pork rinds, like fun things like that. Like those are things that I would rather give back the control, and what better way to do that in a very colorful, fun fitness environment. So when you make a structure for a fitness system, make it simple, keep it basic, and come up with 5 exercises you want to do for the day. And after you do those 5 exercises, does there have to be 3 rounds of 8? Maybe that's a good number, but do you have to do them in a row with these guys? No. That's the best part for me, is just get through everything. But it's so hard for our guys to maintain that focus and learn and want to do something, that when they do enjoy something, if they want to go from cone touches to hurdle steps, let them do that. And then you, as the caregiver, as the attendant, as the rec therapist, you keep it. That's your job to be there and do. So it's nice to be able to have the unstructured flow, because they then get the control back, which I think is really, really, really important for our guys to then be able to have that autonomy again. And wherever we can give it to them, I try in my practice at least to give it back to them. So, and then they get to pick their things. So when a guy walks in and he wants to start a workout, I'm just like, well, what do you want to do first? And then I hear hurdle steps. I say, perfect. Let's bring out those hurdle steps. I'm going to say, hey, we need to do 5 rounds of 4 hurdle steps. After we do 4 hurdle steps, we can take a break. I try to lessen the front loading as much as possible and keep it very simple. When we take a break, those guys always just get a break. Like, everybody does weird things, and our guys sometimes just do it in public, and that's okay. So just let them have their minute, and then every time I've now done this and set this up, it's worked. Points of improvement. So we say, all right, we're going to do 2 hurdle steps. Please start in the hoop. Starting in the hoop, this is how we do the hurdle steps. And then you perform it, and then you say, your turn. So then if they go and say they get stuck and say this first one's already too tough, the best part about this system is that you can always make it adaptable. Flip it to where it's way easier. You get the level, you can change, regress, progress the level to wherever these guys are at. Again, setting up the environment to where it's inevitably going to be a success is very important for any type of group. Whether you're coaching an elite volleyball team, you want them to be successful and have that mindset that they are going to be a success and empower that person to do better. So then it becomes a little bit easier for those guys with the gait training that sometimes goes outside, where the outside goes. Say they're still stepping outside because they have a little bit hard time with the range of motion with their knees due to inversion or whatever. You have cones, which I do think I will say is probably the best purchase I've ever made. You go on both sides, and then there's now no more going around the cone. Now we have to go straight. And then if they start getting bad at that, take the cones away. You've now challenged them, and they've met the challenge. Progress it for them. Show them, hey, you've done well. And that comes to, hey, they've progressed something. What do we say to that client to continue that behavior to form, to make sure those motor movements are being learned? You give them behavior-specific praise. Behavior-specific praise is going to be something, I don't know, I am not a BCBA, just a CTRS AT, but BCBAs I've always worked with, so I've picked up some things. But what you want to do is, as soon as they do something and they start lifting that knee and they're going up and over these hurdles, you're saying, man, I really love the way that you're picking up that knee. That's all you need to say, because we're trying to fade out the prompts. We're trying to give them the locus of control. They're doing it independently. The integrity of the movement is going on without me in it. My goal is, as a coach, as a therapist, to slowly step back. Like, I know in our realm of working with autism, you kind of are a therapist and you're like, man, I'm going to be here for quite a while with this person. The progression might not be as fast as what I've seen in like my high, like sports or something else, but we've come to the conclusion that it's going to be a little bit longer for that to happen. But when it does, it's great. Those are big steps, even though it might take months or years versus what we're used to. So again, by the time you are bored, our guys are normally just getting what's happening, which is just a good life lesson for everybody. I don't know. We live in a very fast, what is that? Whenever you need instant gratification. So we don't need the instant gratification. No, it might take a little while, because when that gratification comes and you've been working 8 months with a guy and he's finally getting the hurdle steps that are not 5 inches, but they're 12 inches, it's just a good feeling. You're seeing them walk at home now, working on going up steps without holding a hand railing anymore, or getting sidetracked or pulling their feet and having to get new shoes every month because they do have a gait that's deficient and not working to make sure that their hip flexors are opening up and things like that. So all of this stuff that we're working on with these basic movements and just this different types of praise and encouragement is to get them to become more independent in society, which is why, again, I'll bring it back to sports and fitness. Sports as abstract theory translates very well to the real world. I can work as a team, I can work as a unit, I can communicate with others. Our guys usually have a little bit more trouble with that area, so that's why fitness is going to be a little bit easier to transcend into their day-to-day life, because they are then able to move forward and do the activities of daily living that their parents want them to do, that their caregivers want them to do. They become then more independent. Their medical stuff becomes a little bit less of a priority. They then have time to do things they want. Their sedentary lifestyle goes down, and then we are able to increase the muscle tone, gross motor movements, and just make a overall a little bit happier person. Because if you're able to move and you're not discomforted, that was what I was supposed to bring up earlier, pardon me. The discomfort for our guys, that a lot of our guys are nonverbal, or a generous part of the population are, so being able to communicate that stuff is harder. So for me, as a person coming into fitness from a recreation therapy angle, I noticed that some of the movements that I've seen fellow therapists or attendants do, just because of their background not in fitness, is not good. It's not necessarily safe well-rounded. And I don't expect people to go back to school and try and get a whole thing on anatomy, but being able to figure out how our clients do communicate discomfort or pain, or being able to know some signs of this because you're focused in this population as a therapist, as a caregiver, as a parent, it's not a bad thing to kind of educate yourself and say, oh, I have back pain whenever I sleep like this, or I'm walking and dragging my foot. I should know that my son or daughter also needs to be able to maintain that and work on some of the stabilizing muscles to then be comfortable, live a happy lifestyle. Maybe that's where that maladaptive behavior is coming from, is because they have neck pain, because when they're doing some sort of press at the gym, it's not benefiting them. So safety, again, is what I'm pushing here for the fitness aspect, and being safe while we're doing fitness, while being simple and consistent. Because again, what are guys like? Simplicity and consistency for the most part. Like, I don't know, Minecraft is my fun illusion, because, you just want to go through Minecrafting and going and digging for ore. But okay, so some other thing, I'm just going to now show, I've got like another 10 minutes, so I might show a couple exercises. Is that okay with it? Anybody want to come up? Okay. Then I'll just do a couple demos. Sorry, I just made me giggle. All right. So there is quite a few. Absolutely not was what I was getting from people. I'm never going to point to make somebody come up. So things that we can do for some of the exercises. There's warm-up exercises, there's muscular endurance, and there's strength training. We can do all sorts of things, and all of them are very, very simple. There's no, I think there's a time and a place for Olympic lifting, and I think there's a time and a place for cycling really fast on a bike, but I don't think, if you have someone in your life that's very interested in that, go for it. But for most guys, keeping it simple, making the exercises pretty basic at first, then progressing them on is always a good start. So one that I've noticed that guys really like, besides the hurdle steps, I'm telling you, this one's a big one. I've heard them called turtle steps, wordle step. Breaks are always involving hurdle steps. So that's always fun. Again, I use cones. So I'll start with like a purple cone and end with the yellow cone, and I'll say, all right, we're going to do a farmer's carry. And then you're working on holding, because our guys also have a tendency to have poor fine motor skills or fine motor strength. So these things are called sandbells. And sandbells are really good for gripping and learning to get that Lion King grip again. So we're going to hold it, and I'll say farmer's carry from the purple cone to the yellow cone. They'll start in the hoop, walk all the way there, holding it really tight, and then they're going to turn around and walk back. And then normally it goes like this. It's usually just dropped, and nothing's hurt because it's a sandbell. So with the sandbell, again, a progression, regression, things that you're noticing. I was like, man, my son can definitely hold more weight. Let them hold more weight. As long as you're not seeing things that are making you worried, because as soon as you're worried, I would say, let's stop and reevaluate as a professional. Let's say, maybe we'll keep it lighter, and then we'll just do more reps. It is always going to be my usual go-to for this type of activity, because again, primary priority is going to be safety, and then it's going to be addressing their health, which is, I think, another big thing. But it's cool because with all of this equipment and stuff, you can always make it harder. You can make the distance longer, but it's not causing you to buy anything extra. It's not causing you to necessarily need to if you do go to the gym, all this stuff's usually there. Or if you want to go out in nature and instead of holding a sandbell, you hold the backpack out in front, right? These are all movements that are done pretty naturally in the world, which is why I also like that fitness can transcend both ways, so that they are getting stronger. If you're out and about and you guys are on a camping trip, this can be 15 minutes of activity that you guys do together as a family to then make it more of a regular thing. I really like the idea of a holistic, widespread family getting fitter together, because that always makes everybody happier. Another exercise I'll do, farmer's carries. There's a thing called bear crawls, which I probably won't do here because the camera has to keep going up and down, but it's very fun. And then my favorite one, because I work with several clients in groups with this kind of stuff, is we then have throws, which is working on hand-eye coordination. It's working on partnership. It's working on taking turns. It's doing a lot of things that we want to see in like a very enclosed like a therapist setting and all sorts of game-like setting, but we're making it a physical activity as well. This thing weighs less than 2 pounds. If it hits you, it's like a wiffle ball, but less painful because it doesn't have that sharp. But we work on really slow. So if I have a partner, we just go back and forth, just holding the ball. You get that feeling of being able to increase your core strength, pushing it forward, but your other partner's already on the other end holding it. And then you start saying, all right, now step in the hoop, and we just take a tiny step back. And again, I would keep doing this until the level of proficiency has been met. Does that make sense to everyone? Okay. Because you don't want to say, oh my gosh, they've been doing this for 5 minutes. Our guys really need that extra time. So when you're doing stuff like just for Eric Chesson's Autism Fitness, he has a whole list of things that he'd like for you to go over your client with, like what activities, what exercises can they do. And for some guys, it's taken me 3 weeks, like 3 different sessions to go through and say, hey, we just need to we need to practice this a little bit so you know what's going on, and then I will show you, because our guys just need that little bit of extra time, a little bit extra love. But I think most people need that, but our personal trainers in the world also want you to go and get your money's worth. Anyways, so then with the push throws, we move it back, we scoop throw. This is also a fun one because they get a scoop, they get an overhand throw. It's working all sorts of good core muscles. Eventually you can progress it to where they step out of the hoop, step into the hoop, then throw, and that's where you start working on. You've got higher level guys that want to get into sports or something, then you're then creating a stepping stool to get into something like that. Or if you think they're ready to learn that abstract theory of keeping score, of teammates, that's when, so again, not hating on sports. I feel like when I was writing my notes for this, I was like, oh, I sound so anti-sport. But I do think that there's just a time and a place for it, and the way that this kind of stuff is set up and the way people are diagnosing our guys and working with our guys in hopes for our guys to be stronger, healthier, happier, able to be more independent, fitness for me has seemed like the best option. And I've tried lots. I did a volleyball clinic one time with a bunch of guys with autism, and it was very fun. We had a great time. I got lighter balls and we were passing back and forth. But then I did a fitness session with them, and there was way more engagement, right? Because they don't get, sometimes those guys don't get the instant gratification we do from saying, oh my gosh, I passed this ball perfectly, right? It's more of like, oh, I did it. And this is kind of showing, you're hearing the behavior specific praise, it's coming at you, and then they can do this at home with mom or in the gym or outside, things I talk in the pool with their aquatic therapist. It's just so good for it to be able to go all the way through all walks of life for them. And then I have bands, which I think is also very important. And I think that'll be the last exercise I show you guys, but the sky's the limit with this kind of stuff. And I'm not one to say never. So always, again, trust your better judgment, talk to a healthcare professional, make sure you're doing things right, but always have fun and play a little bit. So these are bands. Bands are fun. And with bands, we do all sorts of things, like working on, our guys normally have kind of like an inverted shoulders, right? And well, a lot of our society does. Texting is kind of tough. Computers are kind of tough. So working on expanding this, and again, having taller posture, being a more confident human. So for warm-ups, you fold the band in half. Man, I feel like a magician with all these cameras. And then you fold it again. You hold it on the outside again, working on those fine motor skill grips and pulling, and then they'll be walking with an overhead carry. We have different things where we pull and push and are challenging our clients with this trunk stability. That's actually very, very hard. That right there is very hard. But being able to constantly pull something tight, and that's a focus thing for our guys too, in a sense that sometimes the focus is very sporadic or not super intense, but when they're able to focus on a skill for 15 feet forwards and backwards and still able to hold that, that's almost like following a command, like playing a whole round of Scrabble, right? You have to see where that kind of stuff, where the cognitive aspect or the adaptation, behaviors, like all that stuff's coming together by them being able to control their body and know purposely in space the kinetic area that they're in, because that can also be something that you're working on with your client, child, caregiver. But I think this program's great. I think colorful cones are important just in life. Use those for lots of things. Holding parking spots. People are less angry if it's a purple cone. And hoops to generate where you should stand. Labeling and being consistent in your fitness activities, as well as behavior specific praise, and creating an environment that will inevitably be successful for your client in not just this autism fitness I was talking about with Eric Chesson, but also in aquatics, in going outdoors, in whatever adaptive equipment or things you want that's going to be helpful. Yoga, all that stuff for our guys is very important. So I could go into more about behavior control with this, or we could do like 10 minutes of question and answer. So Facebook Live, does anybody have any questions?
So I have a question.
Yes.
So my son is 11 and he tends to be very anti-fitness. He just has a negative self-perception about his ability to do things. So he has a lot of those challenges you talked about with gait or
trunk stability.
Yes. So do you have any suggestions on how to get started or how you've helped encourage other clients?
Yes, I think that's great. So again, cones.
Mm-hmm.
So you have cones and you make it a game.
Right.
A lot of this stuff is game-like. And first you start with, hey, just try it. Try the hurdle steps, see if you can get over it. And sometimes if the gait's not good, they're very surprised that they can't do it and the challenge eventually. But different people respond differently to challenges. They might get a little defeated because say, man, you really tried. Let's move these down and try again, right? And remember starting where they're going to be successful.
Right.
Maybe start at a baseline of something low and then moving to where they can do it. And every time you hear, oh man, I did do that, I can do that, I've seen a lot of snaps happen like, oh, I can do this. Like, oh, and this is what I use in coaching too. It's like, this kid is very anti wanting to play volleyball. Her mom has forced her to be there. She goes in, I'm just like, well, just try this once. And then tries it. And I'll say, man, your elbows were good. Keep working on the specificity of, man, you're doing this right. Try it one more time. And then to make kids really like things is games. I don't know if your son likes games, I'm sure. But okay, this with cones, say you want to, I would start with the throwing stuff just because throwing is so much more applicable to boys, because I also coach boys volleyball, and so I get that they love to throw and move and be dudes. So there's a game called Cone Carnage, and we'll try and get this on tape. But they're really standing, but you're working on the overhead, the push, or the scoop throw, but you're knocking down all the cones. And then you start with like, oh. And so this didn't make a mess. Nothing broke. This is very light. You could use a beach ball or a blow-up ball, but it's something where you're like, oh, and now we're going to work on the push throw and move it to an exercise. Get a heavier ball, move the space back, and then you can say, let's play another round of Cone Carnage. Find the reinforcer that's very exciting for the guys, find the motivator, and then we'll start increasing the ability and the interest and the want. And then again, it moves towards the betterment of the movement and the technique. Is that better?
Yeah.
So motivation is huge. I don't think I really covered that in the beginning, but big. Find something that your guy or lady likes to do and make that after the contingent. Oh my gosh, the PERMAC principle. Okay, so BCBA PERMAC principle, if then statements. If you finish 4 hurdles, then we will blank. I'm not a big food contingency person. I don't know. I've only done that with one client, and he really liked pork rinds. I've never eaten a pork rind since working with that client, but it's 0 calories is what I found out. But besides that, I've always had just some sort of contingency of like, you get a break, maybe their break, or you get to throw the ball against the wall. Something they like to do that's not harmful, that's not a maladaptive behavior, something that they like to do. And if it's singing and skipping around the room, again, I'm in Austin and I like to keep it weird, and they can keep it as weird as they want, as long as whatever they earned from that contingency is theirs. And then that becomes theirs, and then we can move forward. Because they know after every single time they do something, they are getting something from you. You've set the expectation and you're trustworthy as a practitioner and you're meeting it. So developing the rapport, the trust is huge. Motivation. Is that okay?
Yeah, I think super helpful. Thank you.
Cone Carnage is also a really fun game just to play by yourself.
Yeah. Do you have a question? I have another one. Can you tell me a little bit just about what you guys do at Fresh Bloom? Like, do you work with individual families or?
So Fresh Bloom, so I got out of grad school a year and a half ago. Sarah Norris just started the company. We are independent contractors, and we work with individuals either on the Touch of Class program or Medicaid, Medicare, DSSW. But we also do private clients working with addiction and recovery services all around the Austin proper area. And we do aquatics, recreation, usually one-on-one, but we are branching into starting doing some fitness classes. That's in the works right now because the need is there. We would like to help out in whatever way we can. So yeah, just learning more, getting more so that we can, because the population, again, like I said, I always get parents saying, you're a rec therapist, can you take my kid to the gym? And I was like, well, I do other things too. So just different, but yes. So that's kind of an overview of what we do at Fresh Bloom. We also have lots of fun. So, but yeah, if you ever want to contact us, it's sarah@freshbloom.net, NET, not .com.
And I have another question. Do you do it in the client's home, or do you have a space?
We're usually community-based in some situations. Sometimes we have to be at the home, but yes, we also we've coordinated with different gyms to do different pools. St. David's is currently under construction where I used to do most of my work, but we go to LA Fitnesses where our clients can come with us. And it's an easy transition because they, like YMCA, work with Silver Sneakers and Medicaid, Medicare. We also go in-home visits if that's what the situation, if that's where the client's at, we usually meet them where they're at. But it's a lot of community-based settings where we go into, and re-entry outings. Yeah. Okay. Thank you guys for having me today. I appreciate it. See you guys soon. Thank you. Okay. Sorry. Do you want to stand in the group? Just go ahead and introduce yourself.
Okay, so my name is Jamie Rock. I am a clinical instructor in nursing at the University of Texas School of Nursing, but I'm also working on my dissertation study. I'm a doctoral candidate in the area of autism research. Sorry, I'll stop saying here eventually as I get into this. But I also am a registered nurse and a parent of a kiddo on the spectrum. My son, like many people on the spectrum, started out pretty rough with lots of medical needs, including seizures and gut issues, and he had anxiety and everything else. Right now he's doing pretty well, but it's rare to think that people on the spectrum will not need some support and independence in being able to manage their health at some point in their life. And that's why I got into this area of research and thinking about what my son's quality of life was going to be at some point. And so I started looking at adolescent health transition and how people on the spectrum learn how to manage their health. So that's what this particular presentation is about. So I'm going to tell you a little bit about what health self-management is and what that looks like within the spectrum. It's important to understand that this perspective comes from the 2011 clinical report from the American Academy of Pediatrics. And in thinking of this as a transition of healthcare and not a single, all of a sudden you're going to know how to self-manage. This is actually, it takes time and it is a process. And so that's when I say health self-management, while eventually you will be able to self-manage at the best of your ability, it's important to think of this as a transition of acquiring these skills and abilities. So again, using the American Academy of Pediatrics transition of health recommendations, I'll kind of go through that. And then looking at the roles, because you're not in this piece alone, looking at the roles of the healthcare provider, family caregiver, or the individual in managing your health. And then I'll discuss some resources and information that is out there. So why is this important? 95% of the ASD population have a co-occurring healthcare condition outside of their autism diagnosis, up to 95%. And that's at least one co-occurring. In many instances, there's multiple co-occurring conditions. And so, and these can be physical, these can be mental, and they can be developmental conditions that you're managing. Individuals on the spectrum are at increased risk for almost all mental and physical health conditions. Untreated and undertreated co-occurring health conditions are the #1 leading cause of premature death, and individuals on the spectrum have about a life expectancy about half that of the general population. Pretty insightful and not okay. Not okay that we are not addressing this particular issue. So to kind of offset that, we have some positive pieces in that access to family-centered care has been shown to positively impact this early mortality. We know more now about autism than we ever have before. There's more research in recent years that is informing us all the time. And the good thing is we're starting to hear from individuals on the spectrum themselves, because nobody can speak for them but them. And so bringing that voice into research is such an important piece. And then family resilience has been shown to be able to offset some of this mortality as well. So looking at that 95% of people that are on the spectrum that have a co-occurring health condition, and looking at the increased need that they have for healthcare costs, individuals on the spectrum fall with, especially youth, fall into that category of youth with special healthcare needs, which is about 13 million people. The definition, of course, is those who have the increased risk for chronic physical, developmental, emotional, behavioral health requirements for health, and then required amount beyond that is required for children generally. And while our individuals on the spectrum fall within this category, there's also some specific pieces that come along with individuals that are on the spectrum, because not only are they managing a healthcare condition, they're also managing the complexity of having autism, along with the communication and the social deficits, being able to manage executive functioning and sensory issues as well. So taking it all into consideration, you have to pull individuals out of the spectrum, or pull individuals along the spectrum out of this youth with special health care needs as well. So what is self-management? It's health. It's integral to both maintenance of wellness, but also the management of illness, because it's like I said, well, not everybody on the spectrum has a healthcare condition that they're managing. At some point in their lifetime, likely they will be sick, and knowing how to manage that healthcare condition is going to be an important piece in maintaining their health. Not only that, these are vital skills in order to carry them throughout their lifetime. So in looking at the individual and family self-management theory and health behavior change, there's 3 domains that follow along that self-management piece. They're the contextual pieces that would include the complexity of an individual's autism, the amount of co-occurring health conditions that they have, the family's level of resiliency, their access to family-centered care. There's a bunch of different pieces that fall along that contextual piece, but it's important to think about those pieces and how they impact a family's ability to self-manage. So in the process domain, that gets into the knowledge and beliefs, skill regulation and abilities, and social facilitation, and how that impacts individual's readiness to be able to self-manage. And then, of course, the outcome is being able to engage in self-management. So if you think about it, could the complexity of a person's autism impact their motivation to self-manage? And of course, you can see how that would impact their engagement. So thinking about the process through those 3 different pieces. There's a lot that goes into those different pieces, but that just gives you a kind of an idea. What I love about this is there's 3 different perspectives that you have to consider within the medical home. So again, we were talking about access to family-centered care. That's the preventative care, acute illness management, and chronic condition management, applying evidence-based planning and proactive care. And the sad part about that is only 18.9% of individuals on the spectrum have access to family-centered care. And so there's a lot of management taking part by parents. Family-centered care involves mutual respect, and if you can, it's like I said, if you can think about, there's 3 different perspectives. An individual is trying to boost their own personal autonomy and their health in most cases. This is a part of normal development and growth. A parent who has to undergo their own transition and letting go of some of this responsibility that they've held on for so long, that's scary for parents. And it comes right down to it. If you think about as parents try to let go of some of this responsibility, and their child is learning to add some of these responsibilities to their ability, their skills, there's a huge gap in there. And that gap is extremely scary for parents. What if I let go too soon? And, what happens to my child's health? So there's a big part for parents that make them reluctant to take part in this process without proper supports. And then the healthcare providers are out there saying, I don't know enough to be able to support this system. And so it's important to get these 3 perspectives on board and being able to understand how the medical home is going to function. So understanding where the other is coming from is the first step. And knowing, because they do come from different pieces. And then all are different places. And all youth, especially youth with special health care needs, according to the American Academy of Pediatrics, will benefit from being able to take part in healthcare autonomy to the best of their ability. It improves their quality of life. It improves their healthcare outcomes by them taking ownership, and it is an important part of growth and development. So, first step for healthcare providers is to stop thinking of autism on this linear line of having being high functioning and low functioning. The indications by most people along in the healthcare is that low functioning means you have less abilities. Generally speaking, it's probably somebody who is nonverbal, has IDD, those kind of pieces. They get pushed down here into this low functioning and then people with less deficits get categorized into this high functioning piece. And I'm telling you, this is not helpful for thinking about how to self-manage. If you think about the spectrum in this ability of having mastery and absence of skills, you have to think about their particular piece in their autism and their communication skills. Some people communicate very well, while some people may not be verbal at all. But that doesn't mean that they can't adapt to being able to communicate. Finding where and completely assessing somebody along this piece is vital to be able to understand the spectrum. So this is not helpful and it limits self-management. So recommendations according to the American Academy of Pediatrics 2011 clinical report. By age 13, there should be a discussion with youth and the caregiver or caregivers, expectation of transition to adult responsibilities. Understanding this is the ultimate goal to the best of one's ability by age 13. Assess youth self-management skills beginning at age 12 years and again annually. Again, thinking along the spectrum, the whole spectrum, and not that linear line. Engage youth and caregivers in transition planning, patient education, and transition readiness at least annually beginning at age 13. Now that readiness piece, if you look at the trans-theoretical model, is the weighing of pros and cons. So somebody might think there's, in looking at this, looking at somebody's motivation, they might have more cons than pros, and it might impact their ability to think, maybe I'm not ready for this. But as they get older, maturity and time does play a role in this as well. And so that's why while you might want to introduce at age 13, that doesn't mean that somebody couldn't understand that weighing of pros and cons and at some point reach that pro piece to be able to say, yep, I want to engage in self-management. I want to take on this piece of my health. And it's important to understand that this is not a all or nothing. You know, you might start with one piece of self-management, maybe just managing, taking medications on a daily basis and start there and then grow from there in their abilities. So again, that readiness piece is an important part, and it's important to assess it on an annual basis. Initiates discussion regarding use legal competence beginning at age 14. Again, when somebody hits 18 years of age, their coverage begins to change and their legal competence and all of those pieces start to fall in place. It's an important piece to start addressing at age 14 to find out what that looks like in the long run. Ensures transition plan meets the comprehensive needs of the youth. Okay, so putting in supports that help that help support the individual too. Develops and verifies ongoing healthcare summary of use, healthcare condition. So again, this is addressing, thinking about those contextual pieces. You're looking at the complexity of the individual's autism and those co-occurring conditions, and keeping a healthcare summary that's up to date informs the whole healthcare team about those needs. And then being able to collaborate with the youth and caregiver and identifying appropriate adult provider once they're ready to make that transition, whenever that might be. So, big piece for the healthcare provider. Yeah, that's right. But the problem that we have is like 70% of healthcare providers are saying they don't have this knowledge. And so putting this algorithm and this information out and then giving them a framework is a good way to help them, provide them with that guidance. For parents, again, undergoing transition, that transition for them as one from the person that's managing all of these health and doing all the collaboration between different caregivers and all of this piece that they've been managing for so long, starting to let go of that. And again, you can't let go of that all at the same time. That is, again, a transition of being able to give up a little bit at a time and making sure that gap isn't so great that you're setting the individual up for failure. Understanding how the healthcare environment changes when the child becomes an adult, because they have different needs. That doesn't mean that when they turn 18, they might be ready for an adult provider right then. It could be that they stay with their pediatrician, but start making that transition. That this is a process. So you got that assessment of continuous assessment is going to tell you when they're ready. Active engagement in and open to transition process. Sorry. It's a hard one for some parents, and it's not just parents of kiddos on the spectrum. It also has to do with youth, parents of youth with special healthcare needs. There's so much documentation that talks about how hard it is for parents to let go of this piece that goes against everything they believed in as far as making sure their child is safe, and letting go of that is kind of scary. So acknowledging that and making sure that they understand that this is an important part of their child's growth and development. And then empower their child towards health, autonomy, independence, and self-care to the fullest ability of the child or the individual. So for the youth, there's a lot that goes on there too, because we don't know what motivation there is in being able to take on this piece. If you look at, there's a lot of research from Christina Nicolaitis looking at adults that are on the spectrum from their perspective, and there seems to be a lot of motivation. They have interest in being able to take on this piece, but feel like the supports are not there. For adolescents, none of this information from people on the spectrum is out there for adolescents. So I'm trying to that's part of my dissertation, is trying to find out from adolescents what this looks like and what their motivation is. And so being a part of that shared decision making and establishing goals and objectives, they are an important part just of that medical home Finding out what their motivation is an important piece. And then develop the self-management skills and tools. This is work, this is work on people's parts, and being able to learn these skills and abilities, learning the knowledge about their healthcare condition, learning what medications they're taking and why. Those are all parts of being able to manage their health. Being able to identify and assess their health stats. Am I getting sick? My throat's sore. Maybe my anxiety is a little bit worse today. Maybe I need to make an appointment with my therapist. Right? So those pieces. Keeping a medical journal for people that are nonverbal, or because communication is a problem for some people on the spectrum to a certain extent. Maybe keeping that medical journal is a good way of them logging and keeping track of their healthcare condition. And it helps to focus when you go in to see the doctor, and being able to voice those pieces. Adaptive devices are fantastic, especially apps. There's a bazillion apps out there that help you to manage executive functioning pieces, the communication pieces, and helping you to organize setting alarms and those kind of reminders. And there's a ton of toolkits, which I'll share with you guys if you're interested. And especially for Aspire is the one from Christina Nicolaitis up in Oregon. It's for healthcare providers and for adults. It's a fantastic toolkit. And then with executive function deficits, consider cognitive remediation programs. There's some pieces that help you with the processing of certain things. It's all ways of adapting. So for my area of dissertation, I'm looking at the self-management within adolescents on the spectrum. And what I found with all of my research and the literature review is that so much of the self-management piece falls within transition. So again, we're talking about it being a transition of this, it's a process of transition from parent or provider to the individual. And then in this piece, because I'm looking at adolescents, there's a huge piece between this transition from parent to child. And this is that social facilitation, what the parent is doing to prepare their child, what the adolescent is doing to try to learn how to manage their health. So along with that comes a whole lot of beliefs and skills and ability and knowledge. So looking at those contextual pieces, the risk and protective factors that families come in with, their knowledge and abilities and their skills, the social facilitation between the parent and the adolescent, and how that impacts their engagement and health in their health behaviors. And then this readiness piece again is looking at the weighing the pros and cons. Have we even thought about this? Has it even come up? And so that readiness is a part of my dissertation as well. So, thank you. Questions?
Would you repeat the name of that researcher, Christina from Oregon?
Nicolaitis, yep. I have actually the references are on here too, but there's also one in there. But
I pulled it up for you.
Yeah. So here. So I'm looking at
and the PowerPoint is posted in the comments as well, so people can access it.
okay. So her stuff is not in here, but this is her toolkit. It is autismandhealth.org.
Okay.
So it's like I said, it's Aspire, ASPIRE, I do believe is the name of the toolkit. But if you go to https:// and then the autismandhealth.org /, that is a way to reach that particular toolkit. But I have some other ones and I can post them. There's a ton of some really helpful toolkits on making this transition, this piece, and taking it on. And in the meantime, if you're interested in being on my part, taking part in my study, I'm looking for individuals who are 12 to 22 years old on the spectrum and their parent. So I'm looking at parents and the adolescent as well. in how they manage their health care in being able to answer these questions. It is such an important piece to be a part of invoicing what it's like to be an individual on the spectrum in this area, because we have known nothing about it, and it comes right down to it for adolescents. There's none of the research is out there. So trying to gather it and understand it so we can put the interventions and resources in place.
How long are you accepting people into your study?
Until I reach I'm looking for 90 dyads. So I'll
Okay.
keep on taking people in, and I have a year with IRB approval. I have a year to
Okay.
pull people in. So the more people I have, the better.
And there's some sort of, do they get a gift certificate?
They do. $25 compensation for the individual, $25 compensation for the parent. So
Okay.
yeah, so it's and it's an online survey. It takes about 15 to 20, 15 to 30 minutes basically. Takes parents a little bit longer just because they do a background piece and have more items than the adolescent. But it's multiple choice, Likert style scale questions, yes, no. So yeah, so love to, yeah.
We'll post that on here
We
too.
will.
Perfect, yeah. I'd
Thank
love
you.
to hear any questions. Please let me know.
Okay, yeah, thank you so
Thank
much
you.
for coming today.
Thanks for
Thank
letting me
you.
speak.
Yeah.
Okay, thank you.
Absolutely.
No, I
We reached out to the company. So we've been in touch with them.